Okay, let's give her a big round of applause, you guys. All right, so my name's Alyssa Byrd. I am the radiology manager out at Norley Hospital here in Lovington. I manage the radiology department here at the main campus, and we have an offsite in Hobbs. Okay. How many of you in this room have ever had an X-ray, an ultrasound, a CT, anything of that kind? Raise your hands. Okay, majority of you. So those of you that have, that would have been done by, that's what I do for a living. So when I was y'all's age, I said I actually wanted to teach middle school math. Everybody looked at me, laughed, and was like, hey, you're crazy that you want to teach middle school math. But I thought it would be really cool. Math was an interest of mine. Then I went to a conference in Arizona, and it was a medical-based conference. And my mom is actually the one who encouraged me to go. She was like, you don't know what's out there, because I was like, I don't want to be a nurse. Like, I don't want to deal with the guts and the blood and nurses. Like, we need them, they're great, but not for me. And so I was like, well, I'll give it a whirl. And so I went, and at this conference, I got to go to the Mayo Clinic, which is in Arizona, and I got to go through a radiology department. And the minute they showed me images inside of the body, I was like, that is cool. I want to do that for a living. And so that's how my career path from about junior high kind of changed from teaching math to where I am today. So when I got out of high school, when I graduated high school, I attended South Plains College in Loveland. And I started working on all my classes to be able, what we call prereqs, which is what you need before you apply for a program like that, at South Plains. And if you don't know anything about those programs, they're usually a 2-year program, and they're pretty competitive to get in. They only take a select number, usually a class of about 10 to 15, okay? So that first year that after I did prereqs, I applied and I didn't get in. But guess what? Life throws us curveballs, right? And sometimes our plans don't go the way that we think they're going to. But that's okay. We keep reaching for our goals, and that's exactly what I did. And so I took that next year to finish off an associate's in science, and I graduated with that May. And I was accepted into the Rad Tech program, and I started that August. It's a 2-year program, so you learn the physics of X-ray equipment, how the equipment works, how to position bodies, what images you need to get of different body parts. And it's a pretty intense 2-year program. I'm not gonna lie, I struggled, but that was just part of learning. It's a different way of learning than what I was used to. And so I did that, and I graduated. But when I graduated, the market was a little bit flooded. There was a lot of techs graduating at the time, and there wasn't a whole lot of jobs. So I applied to ultrasound school, which is different than X-ray, but still in the imaging realm. And I got into that program, and I started that January. So it took me 4 semesters before I graduated with that. So I'm what you call a multimodality tech. So I do X-ray, CT, and ultrasound, which is pretty rare, but is a super advantage for a small facility like here at Norley. The great thing about Norley is I can walk in one morning and do a CAT scan, turn around, do an X-ray, turn around, do an ultrasound. If you go to a big facility like, say, Dallas-Fort Worth, something like that, that's not as common. You typically stay in one area, either X-ray, CT, something like that. And then while I was working on my ultrasound degree, I went ahead and decided I wanted to get a bachelor's degree in radiology. So I was working on that at the same time, and I graduated a year later. So I hold quite a a few degrees. They're not all necessary to be a rad tech. Usually a rad tech only takes a 2-year degree in completion of that program. Okay. So, and then I decided, I don't know, that was crazy, I guess. Decided I was gonna get a master's. I've completed my master's last year in radiology administration. The push for that was I moved into a leadership position out at Norlee, and I felt like it would be beneficial to my kind of career plan. So that's kind of all the schooling I had. But what we do kind of on a typical daily basis is we do have a schedule of like our CT patients, which is CAT scan. So that's a machine that does a full 360, creating x-rays. And you go in and out that tube and it gives you a 3-dimensional image. And then x-ray is just a 2-dimensional image created by x-rays. So they're created the same way, in a way. CT just rotates, basically. So our typical day, we do have a CAT scan schedule of about 8 to 10 patients, but we usually, by the time the ER adds on everything and we get add-ons from the district, we average about 20 patients or so a day. So pretty busy for one machine. And then we just shoot x-rays as they come in. So like you fall, you hurt your arm, you come in, you take your picture. And then ultrasound, does anybody know the difference between x-ray and ultrasound? What's the difference?
An x-ray is supposed to like do your bones, while the ultrasound is supposed to see a baby.
Yes. We can also, with ultrasound, look at different things like livers, gallbladders, thyroids, right up here. But they're created differently. So x-rays are created by an x-ray beam, created by a cathode and an anode. Ultrasound is created by sound waves. So what it does is the probe that you hold sends out a signal and listens for a return, and that's how images are created. So they both look inside the body, just a little bit different way. Most of the misconception is that ultrasound only looks at babies. We don't just look at babies, but that's kind of, people think, oh, I don't want to go into ultrasound because I'm looking at babies. We look at a lot of different things. Like I said, thyroid, belly, kidneys. You can actually go into what's called cardiac or vascular sonography or ultrasound, which looks at your heart or the veins and vessels in the arms or legs. So the cool part about imaging for me was the variety and things you can do in a day. You don't just have to, you may start your career as an x-ray tech. That's a pretty common path, but from there you can go into different modalities. So like moving into CAT scan. You could also move into MRI. What's the difference between an MRI and an x-ray? Does anybody know? An MRI is a big magnet, like big magnet. And so it creates images by, it kind of shifts your molecules, if you will, and it creates an image that way. And so it doesn't use radiation at all. It just solely uses the magnet. And so you can also go into that. You can also go into mammography. Anybody know what that is? A mammo is basically imaging of the breast. So that's how we detect breast cancer. And so you could move into that. There's also other options. We don't have them here at Norlee, but some bigger facilities do, such as cath lab, which is where they go in and they may put stents in the heart. They might cauterize something in the heart, and they use live x-ray to do that. You can actually inject contrast real time and see it on an x-ray. You can also do strictly OR work, which is our operating room. When they're fixing, like my son just the other day, well, about a month ago, cut his finger and fractured it, and they used x-ray to make sure the pin they were putting in place lined up correctly, because they can see that with x-ray. So there's a lot of different options and ways that you can grow in x-ray. It's a really cool field. I like being able to see inside bodies. Yeah, we still see some of the gross stuff, you know, traumas coming in through the ER, car accidents, that kind of stuff, but it's not on the level of like a nurse has to deal with them. nurses a lot of times have patients for 4 hours. You know, if you're on the floor, you may have that same patient for the whole shift. Whereas x-ray, we're seeing multiple patients every hour. And that's cool to me. It's fast paced. That's why I liked it. And that's kind of to what drew me to the field. Any questions? That's a real fast, short, but I will happily answer anything about x-ray. Seeing in bodies, things I've seen. What you got?
Do you enjoy your job?
I do enjoy my job. I think, like I said, what's cool to me is that no 2 days are the same. We may have 5 CTs of a belly every single day. But what's different is every patient's different, and we may find different things on that patient. And so sometimes we can see that the patient may have like a cancer before the patient ever knows. And to me, I helped that patient. We helped find that by imaging their body. And so that's why I like it too, is I'm helping somebody just in a different way than like a nurse would. What you got?
Can you describe your typical day?
So my typical day is a little different because I'm the manager out there. So usually my day, I come in and I check on everybody, make sure everybody has what they need to do their job, and then I do office work, making sure charts are correct, that billing is correct. It's kind of the boring side of being a boss. But I do, if they get busy down there, I will go out, I'll help shoot x-rays. I do troubleshoot equipment sometimes equipment malfunctions, and us being so small and away from help, so to speak, we have to kind of try to figure out what's going on with it so that when I call the service engineer, I already have a good idea of what they need so that they can come out and fix it. But and then like I said, I may image patients. I may get patients where they need to go. Today, I had a patient who was worried about the results she got and had some questions, so they called me over and I met with them. I talked with our radiologist about changing protocols and how we do things and making sure he had what he needed. He's the guy who reads all the work that we do, and so I work real closely with him on a daily basis.
Where did you go to school? Like, not college, but before college. Where are you from?
I am from here. I was born and raised here. I actually came through this school, graduated from Lovington High. How many in this room have said they would never come back to Lovington? They're gonna leave and they're never gonna come back. One. Be honest, it's okay. Y'all can be honest. You can say I hate it, it's fine. I said the same thing. I swore that I would never come back to Lovington. I thought I wanted big city life. I actually wanted to work at a pediatric only facility. So I wanted to work only with kids. And turns out I met the love of my life and got married, and he wanted to move back here because he was from here, and I was like, okay. And then 12 years later, we're still here. But that's how I ended up here, but I graduated from Lovington High. What you got?
What are some things you don't like about your job?
Some things I don't like. I would have to say seeing people in pain. It's not fun. We a lot of times have to move them. Their arm's broke and we have to move it to get what we need. And that's hard. I've seen patients who get news that maybe not so great. Maybe they have a cancer, or maybe we worked on their family member trying to save their life and they didn't make it. Those are the days that are hard for me. Anybody else? What you got?
Do you get paid overtime?
I do get paid well, let me back up. As a rad tech, you get paid overtime. I'm a manager, so I have a set salary, but when you're an x-ray tech or CT tech, you get paid overtime. And my techs, they actually take what we call call weeks. So unfortunately, in a hospital atmosphere, it's 24/7, 365, doesn't ever shut down because you never know when somebody's gonna need something. So they take what's called call weeks, which is basically if the tech who is there working has a multiple car accident come in and they need another set of hands, that person will come in. So, but they do get paid to take that call. We call it backup. And so they get paid extra when it's their weeks. And then if they come in, they get paid time and a half.
Are they on call the entire week?
Yes, they do a week at a time. It just makes it easier. I have a total of 12 techs at this point. And they, so they only pull call once every 3 months. So, how many days a week do I work? I work 5 days a week. I have some staff who work what we call 3/12s. So they work 3 days in a row, 12-hour shifts, which is kind of similar to a nurse's schedule. And then I have a few that work 4/10s, which is 4 10-hour days. And then I have some who work 5 8-hour days. So it varies.
Does your job seem exciting to you?
Yes. I think it's cool to see inside bodies. I'm nerdy and it's weird, but I think anatomy is cool. I also love that I get to teach new ones coming in. So when they graduate x-ray school, out here, all of our techs that we hire will learn CT very quickly because we're such a small facility that I need them to have both those skills. It just makes our department flow better. So I like being able to teach new techs CT and stuff like that.
Have you ever thought about giving that up?
To be honest, yes. COVID was hard. COVID was really hard. The days were long, especially wearing all the gear we were wearing. And we were seeing an increased patient load, especially during some of our big surges, and it was hard. But at the end of the day, what brought me back over and over and over again was knowing that the work I did made an impact to the community.
Are there any health hazards in this job?
Health hazards? Yes, just like there is with nursing, being a doctor. There's always a chance you can catch respiratory diseases. We try not to. That's why we have what we call certain set of precautions. So there's that. It is a physically demanding job. We're not outside baking in the heat and the cold every day like the local guys around here, but we move patients. So say they're not able to move, we help them stand, we move them to the table. We're moving heavy equipment around, so those are some of the risks. A common risk in imaging professionals is either knees or back from moving patients or standing all day. And the ultrasound side of it is carpal tunnel wrist work, damage to that from scanning with the same hand. What you got?
How much money do you make in a year?
In a year, I didn't calculate my salary. Good paycheck. Our starting rate for a basic grad tech is about $25 an hour. What you
Do
got?
you have any hobbies?
Any hobbies? So I'm a youth director on the side, so there is that. I would consider that a hobby at my church. And then I have 2 kids. I have a 9-year-old son, Landon. He is actually deaf, and he has implants to help him hear. And then I have a 6-year-old son, Lyle, and so we like to spend time with our boys. We do Boy Scouts. We like to go camping. I like to go hiking in the woods. It's just quiet and peaceful. What you got? Favorite classes? Well, I hate English, so sorry for you English people around here. That is not me. Math and science were some of my favorite classes in school.
Do you have to travel much in your job?
Travel? Not too much. I travel for recruiting events, go to visit the schools, so we get students in, we're what we call a clinical site. So Clovis Community College will send us students, and so sometimes I go up there for stuff they have, and I've gone to Wisconsin before with my job to see new equipment. I've also gone to Montana, not much in Montana, but been to Montana to see equipment as well. So those are a few trips I've taken with work. What you got?
Are you scared when you're moving the x-rays around?
No, because they teach you, they really prepare you. Those programs are meant to prepare you for the work you do every day. And so how that program works is not only do you do classroom work, but you do what's called clinicals, which means you spend time in a hospital learning from other techs. And so it's like on the job teaching kind of. And so I felt really prepared when I came out of the program to be out there on my own.
What are the best jobs in your field?
So if you were gonna move into imaging and you wanted to be one of the highest paid modalities, probably would be MRI, is one of the top ones, and cardiac sonography is another really high one. But hearts were boring to me, so I didn't do that. What you got?
Have you ever had a loved one as a patient?
Yes.
Okay.
I've had several, and you just have to remember that your job is to take care of them, and yes, you love them and you care for them, but you have a job to do, and so, you just keep that in mind, you do that first, and then.
Will you receive a pension when you retire?
Do what? Say that again.
Will you receive a pension when you retire?
So I have a retirement plan. So the hospital has a really good retirement plan that you can pay into. So yes, I'll have retirement.
How many years have you been with Norley?
I have been with Norley for 12 years. So 12 years, the same job every day. What you got?
How would you advise me to find my teacher?
If you wanted to go into X-ray, I would say come pay us a visit. So we've worked with the schools before, and we love to have students out, kind of show you what it's all about so that you get a feel for that. And then I would say you need to do good in school because the programs are competitive. So you've got to have the grades to be competitive when you are applying for those programs. And then I would say apply to more than one program at a time because they only accept 12 to 15 students at a time. If you really want to get into a program, I would apply to more than one. I actually applied to a program in Tyler, Texas, and I actually was accepted there before I knew South Plains had accepted me. And once I got my acceptance to South Plains, that was the program I had wanted to be in, so I declined my offer in Tyler. But I really wanted to get in, so I was willing to move. What you got, Lacey?
I was wondering if you'd do a scenario demonstration real quick.
Of?
So like, this is my patient, stand up, for my son.
Oh, what's your
He
son?
has a broken shoulder, like
Oh.
right here.
Yeah.
So we're gonna come see you, right? So this is what, like, I want y'all to see like what you do.
Yeah.
So
Look, I got you a chair.
So that's our office.
So normally an X-ray room, for those of you that haven't been in there, will have a table that raises and lowers. It'll have a tube hanging from the ceiling, and then it'll have something on the wall, okay, or standing off the wall. If we were shooting his shoulder, he would take his arm out. Let me see your hand. He's gonna take his arm out like this, and so it's gonna turn his shoulder out. Bring your palm up. Okay. So That's what's called an external view of the shoulder. And then he would take his hand in, and now you have an internal rotation of the shoulder. So if we were shooting his shoulder, we would shoot 2 pictures right through the shoulder joint with his hand like this and his hand like this. Now, if we were gonna shoot, say, your wrist, let me see, your wrist. Say he hurt his wrist, do you play sport?
He plays baseball.
You hit the ball a little too hard in your game and you hurt your wrist, okay? So we take what's called 3 pictures of the wrist. One, it would be laying on what we call the cassette, like this, and we would shoot with the x-ray beam straight through the wrist right here, because your wrist joint's here. Then we would rotate it a little bit, like that, and then we would turn it all the way on its side, okay? The reason multiple views are important in x-ray is it gives the radiologist a different perspective. Because sometimes when your wrist is laying like this, everything looks fine, but when you turn it like this, you see a bone going this way. So that's why we take multiple views. Same with ankles, knees, that kind of stuff. We can basically x-ray from head to toe.
What's an x-ray that you would have to do where he was standing up?
Standing up. Chest x-rays. So we do all chest x-rays standing up. We can x-ray your belly standing up. We can also x-ray your belly laying down. The reason we would do one standing and one laying is air rises when you're standing up, and when you're laying down, it levels out. So we look for what we call air fluid levels in the belly. We do shoulders standing, sometimes upper arm, just because it's easier. Sometimes knees, you know, these old ladies with bad knees. Sometimes the docs who do surgery want to see, are your knees even when you stand up? And are they off, so that when they go to fix them, they can make sure they're level with the other so that you don't walk with a limp.
That was fun.
Thank you. Anybody? He's a great patient. He holds still. That's the other thing. We can x-ray little bee babies, but they don't hold still. So a lot of times we have to hold them and they scream. I'm sure y'all have seen on the internet that device with the baby stuck like this, with his arms up. That's called a pigastat. It's just a device to help us hold babies still so that we can get good pictures, but it does look a little torturous. So, yeah.
What's the struggle you go through with getting this?
Mine's time management and balance of all the things I have to do. And well, you'd ask our HR director, he says I'm the most talkative person there. I like to go check on everybody in my team, so sometimes I get a little distracted being out and about and talking to people. Don't laugh, Louise, I know, I come by it honestly, it's fine. But it's time management, because I have work to do within my office, but if they need me out, I will always choose patient care over the work that I have to do in my office. In the back.
What kind of job perspective are they looking at it? If they were to go, what would your guess be on job availability?
Oh, it's needed. So, which not just COVID, some of that happened prior to COVID, but the market, not a lot of people were going into the program. And so there's a need. I actually had 4 openings at one time, was the greatest amount of openings I had. And in May, Clovis Community College graduated 8 students. Of those 8, we hired 4. So we took half of their graduating class, but the thing to think about is we're one facility, and the state of New Mexico has how many hospitals? I'm sure there's a lot. And so there's need. What you got?
The other question I had, does New Mexico have reciprocity with other states where you wouldn't have to go back to school to go to work in another state?
That's a good question. Yes. So what happens is when you graduate, you have to take a national board. It's called the ARRT. And so you become nationally registered as a rad tech, And then that license will carry over to any state. Now, some states, like the state of New Mexico, require you to have a state licensure, but all it is an application and a submission of your ART showing you're current. Now, with our profession, because you always wanna stay current, you do have to do continuing education, 24 hours every 2 years. So, they're all over the internet. You can attend classes, you can read a book and fill out a test. There's lots of ways to get them, but you are required. And with ultrasound, it's 30 every 3 years, so.
Do you need any special physical characteristics to do your job?
I would just say being in good health, and being somewhat fit. I'm not saying you have to be like a bodybuilder, but we do move patients and push wheelchairs, push stretchers. So being in good, decent shape is good. And you're on your feet pretty much all day, so. So many hands. What you got?
How many years have you been working at your job?
I've been at Norley for 12.
How many more years do you plan to work?
Till they kick me out. I always tell Mr. Shaw, which is our CEO, if y'all don't know, that he's gonna have to take me out kicking and screaming, because I'm gonna be there forever. But I don't know when I'll retire. We had somebody who was with us for 37 years. I'd hope to maybe meet that one day. I don't know. We'll see. What you got?
Can both men and women do your job?
Yes. We actually have 3 male techs who work in our department. So, yes.
Okay, last question, guys.
Ooh.
Did you have your?
He had his hand up.
Will you receive a pension when you retire?
I have a retirement, so it's a little bit different.